All right. So what we're going to do is talk about healthcare entrepreneurship and startup strategies. And just hide the controls. Great. Okay.
Push control of the
Can people hear me now?
Now we can.
Okay, great. So the first part of this will be similar to what I've spoken about in the past in terms of what the medtech landscape is like. But I think for people that are new to the seminar series, it's important context for the rest of the seminars going forward. I'm also going to talk about some strategies related to how to start a new technological innovation, whether it's a new product, whether it's a new company, some of the thoughts that have to go into deciding what possible strategies for a potentially successful medtech entrepreneurial venture might be like, and talk about some examples of that. Medical technologies are very relevant to the international commerce. It represents about $500 billion of economic activity, and this is something that's growing steadily at 5 or 6% per year. You know, we talk about a lot of other industries, and a lot of them have some volatility to them. They might shrink one year, grow substantially the next year. MedTech, because of the fact that it's very much related to very predictable demographics, and people are very much dependent on healthcare as part of their livelihood, is one of the more stable, predictable, recession-proof type sectors to be involved in. It is dominated by US multinationals, and we'll talk a bit more about that later. And we're talking a bit about demographics. Every year that goes by, advances in healthcare, advances in social stability and economic stability mean that our average life expectancy grows by 2 months. Okay, so if you were to go back to 1970, the average lifespan might be in the mid-70s. Now it's in the low 80s, and it's every year we add an additional 2 months to our lifespan on average. And the causes of death are trending away from some of what were the largest killers traditionally, which are infectious disease, trauma, and conflict, and heading more to the chronic diseases. And the fact of the matter is that people are willing, and governments and insurance companies have to and are obligated to spend a large portion of their budgets on healthcare. That includes pharma, that includes personal care, that includes doctor services, and it certainly includes medical technologies. And people will insist on that moving forward. So here's just a rough breakdown that you can get from the Global Burden of Disease summary that's published by the World Health Organization and the Lancet. And it talks about how various diseases contribute to the 51 mortalities that happen every year. Cardiovascular disease and neoplasms are the largest of that. Obviously, a lot of other chronic diseases, including orthopedic conditions, chronic respiratory disease, neurodegenerative disease, digestive or GI issues, diabetes, and chronic kidney disease, versus some of the more conventional causes of death in the past, which have been related to maternal deaths, infectious disease, and others. And you can see over the course of time, going from the early 1990s through to 2017, how the blue boxes are getting bigger and the red and the green boxes are getting smaller. And this is a trend that's very predictably going to continue over the course of time. And even in Canada, we have more people now that are over the age of 65 than under the age of 14. And this is something that happened about 15 years ago and is continuing to happen. But it's not just a demographic trend that's happening in Canada. This is something that's happening in the world, that as you go from the year 2000 to 2025, you can see that those younger ages, both male and female, are moving up in age and demographics, such that we're having many more people over the age of 60. And that is where the vast majority of healthcare spending occurs, is in people over the age of 60. That's happening internationally around the world. It's happening in the United States. It's happening in Canada, perhaps a bit more amplified in Canada as a result of a larger baby boomer effect. And it's already happened in places like Japan and Korea. And we have to think, so we're spending more money on medical technologies. Where do these devices come from? How are we going to get them? When I walk around the cath lab here at Sunnybrook and I say, oh, I need a wire, I need a balloon, I need a stent, I need a pacemaker, I need the equipment to help me image as I'm doing these procedures. The vast majority of these technologies come from outside of Canada. Although surprisingly, if you were to look at these different technologies that are up here, this is a TAVI valve. This is a valve that's used to replace the aortic valve. When I was a medical resident in the early 2000s, and someone came in with severe aortic stenosis, in other words, where the valve, where all the blood leaves the heart, was severely restricted, those patients had a 1 to 2 year life expectancy. And once they presented in hospital with symptoms that couldn't be controlled with medications, it was not uncommon for them to pass overnight while people were on call. We couldn't send these patients to an operation because they were typically 80 years old and they would not be able to tolerate a surgery, and they were very frail and they had other comorbidities. We now do 450 procedures a year at Sunnybrook, where we put one of these valves in through the leg in an hour and a half. And we'll do 4 or 5 of those a day. And we'll do these on people who are anywhere from 75 years old up to 100 years old, if they have a good prognosis, if they're expected to have an ability to live an extra 1 to 2 years of good quality life. So that has dramatically changed what was almost universally a fatal condition into something where you can restore functionality and mobility, not without consequences. They don't go perfectly all the time. But that is something that has dramatically changed how we treat patients with this, what used to be a nearly fatal condition. And I think one thing to realize from a Canadian origin perspective is that a lot of the initial cases were done by one of my colleagues, Dr. John Webb in Vancouver, who was the key opinion leader doing the vast majority of the early cases with new heart valve technology. So there's a very strong Canadian root to this technology with respect to its early clinical implementation and training. It was a leadership position that then provided inputs to people all around the world. There are ablation technologies that are used to treat atrial fibrillation. There was a company in Montreal that made a technology much in the same way as you might freeze warts with liquid nitrogen at the family doctor's office, where they made balloons that would go in and freeze parts of the heart to kill some of the myocardium around the pulmonary veins. That was bought by Medtronic about 15 years ago for $400 million, and it became one of the best investments that Medtronic ever made in the cardiovascular space, and grew to being one of the most common ways of treating atrial fibrillation in the past 10 years. Pacemakers, there's a history with respect to how pacemakers were invented simultaneously in Minnesota and with people involved in Toronto. Left atrial appendage occlusion, not so much a Canadian technology, but certainly something we're starting to adopt. And then drug-eluting stents. Stents that go into the coronaries, they used to get a lot of scar tissue that would form on them and block off blood flow. And so 20 to 30% of patients who had a stent implanted in the late 1990s and early 2000s would have to come back within 3, 6, 9 months to get their angioplasty done over again because the scar tissue had formed inside. So 2 doctors in Vancouver said, well, let's combine some cancer drugs with the stents, call them drug-eluting stents. They're now used 4 million times a year around the world to treat the most common cause of death, coronary heart disease. Okay, and that's got a strong Canadian root. It was invented and developed here in Canada, but it then became commercialized by companies like Boston Scientific, Medtronic, a division of Johnson & Johnson, et cetera. So there's a lot of Canadian implications. There are many, many other stories where Canadian R&D, Canadian entrepreneurship has been involved in either the development or the initial clinical use of advanced technologies that are used around the world. So what are the implications of this aging demographic? Certainly if patients are living longer, that's great. They get to go on, they live a little bit longer, but then they come back. And they come back and their medical history is a bit more complicated because often people would pass away after their first or second life-threatening medical condition, now they would live through 2, 3, 4. My father lived through 7 life-threatening medical conditions before he passed away earlier this year. And you can imagine that if you treat all that with drugs, those drugs start interfering with each other. If there are device-based treatments, it tends to have a little bit less cross-contamination between them. So that can lead to a bit more of a durable or permanent and fewer issues with respect to complications from interactions. And so device-based solutions are helpful. They can reduce the dependency on medications. They can be more durable than many medications. They have lower long-term costs in many circumstances and can be more effective. Certainly putting a TAVI valve, a valve to treat aortic stenosis, is far more effective than trying to treat it with medical therapy alone. And if you're treated with a surgical procedure and you have good blood flow to your heart, you're more resilient during other insults, like when you get a pneumonia, when you're in a car accident, when there's some acute stressor. So that's the advantage of surgical and device-based treatments that I wanted to pass on to you, emphasizing its growing importance in our healthcare economy around the world. Globalization is a very important theme within medical technology sector. If you're not focused on the international market, then the likelihood of succeeding is relatively small. You can have Canadian roots and a Canadian origin and early Canadian users. But if you're not focused on the international community, then your chances of succeeding in order to gather the resources needed to build a large company or to advance your technology to its highest potential, and the ability to be resistant to some competition internationally is going to be reduced. So you want to really have a global mindset when it comes to working in the medical technology space. If you were just limited to local markets, you would not have the capital and resources needed in order to be successful with that. And you want to be efficient, and you want to be doing things in the regions that are most efficacious for developing new technologies. I think Canada has some strong points. I think Canada has some weak points with respect to being a locale for medical technology development, and we're trying to address those in part through activities like what MedVentions is doing and others. I show this slide every year, and I update it every year. And we have a really large trade deficit in the medical technology space. In fact, the Canadian trade deficit typically is on the order of $20 billion per year for all sectors. In other words, we buy $20 billion more of stuff from other people in the world than we sell to the rest of the world. Now, when Canada's trade deficit in medical technology alone is $6 billion, that's a large portion of our international trade deficit. So everything that we make up for in mining and resources and banking and construction and consulting and IT goes into funding our medical technology trade deficit. So if we can address this more effectively, this is certainly an area where the government is very sensitive to this. When the COVID pandemic happened, there was a huge uproar with respect to supply chains not being adequate for us to be able to treat our local patients. And it's important from a trade leverage perspective, because when there are tariffs being threatened, when there are disputes with other geopolitical activities happening in the world, medical technologies tends to be a sector that everyone is interested in, that is generally non-controversial in terms of its origins and its use. So having some strength in the medical technology sector can be very helpful from a trade leverage perspective, as well as from a sovereign stability perspective. There are some major stressors in the healthcare system, and one of the challenges that we have, not just at Sunnybrook, but at most hospitals in Canada these days, relates to healthcare human resources. We often have to shut down ICU beds or close procedural activities, or have a rush to spend a lot of money to bring nurses in on a much more expensive private payer basis as opposed to full-time employees. And we have essentially more people to provide care. So we have fewer people to provide more care to more people. Okay, it's all related to that demographic. As people are entering their ages of 60 and above, we have fewer people under the age of 60 on relative terms to provide the care needed and the innovations needed for them. So I want you to keep that in mind if you're thinking about medical technology innovation, because anything you can do to make the healthcare system more productive, more attractive for people to work in, more efficient, is going to really help address this major need within the healthcare system. We have broken global supply chains. They are starting to repair. There's a little bit of a sense of normalcy happening in 2024 relative to the past 4 years. And that's exciting and going to be, I think, a big opportunity for us. And then there's a lot happening with respect to data and AI. And it's important to think about how do we have strategies to make sure that we can capitalize on the opportunities that big data and AI presents to us so that we can, for example, notify someone, oh, that CT scan you had as a result of a motor vehicle accident, the trauma team used that in order to make sure which parts of your skeletal anatomy had to be repaired. But by the way, there was a little signal in there that maybe there's a cardiovascular risk or there's some other risk that you need to be aware of. Should you get a notification about that? Should the healthcare system be sending you a notice saying, hey, by the way, you might want to get followed up for this other thing that was detected in a CT scan, which has gigabytes of data in it, but has been distilled down to 4 or 5 paragraphs specifically focused on why you had that CT scan? So we need to think about how we optimize the use of data, both in terms of giving notifications to patients so that they have some autonomy over their healthcare. We have to think about how we use that data because companies are going to want to access it in order to help develop new technologies or to identify patient populations that could be addressed by things they're developing. And how do you do that in a way that is ethical and fair and respects the autonomy of the patients and the populations that are being served? So we're doing a fair bit of work here with respect to this. And obviously, cybersecurity is a big issue as well. We had a code gray recently, and it shut down the hospital for about 12 hours in terms of being able to really do the rapid responses that you need to in terms of following up on patients. And basically, there's a domino effect that goes for the next 2 weeks after that as you try and catch up on the extra people that were delayed in the emergency room or the notes that didn't get covered or the observations that didn't happen in the usual time course that they ought to. And so the sensitivity to cybersecurity in the healthcare system is paramount and something that needs to be addressed. And increasingly, there are high expectations from patients. And I think that's actually a good thing. You should expect more. We are advancing as a society. We're advancing technologically. I think there's advancements being made in terms of patients and families around their know-how of their conditions and wanting to have a bigger say in terms of deciding how they get treated or what treatments are available to them. And so I think that's a big part of modern medicine that's driving things. So that's kind of the background context that I like to give every year with some additional amendments to it. But now I'm going to talk about some more recent observations and activities that I want to share with you and talk a bit more about strategy for healthcare. In terms of large medtech companies, the vast majority of medical technology employment in Canada, there are 35,000 people involved or employed by the medical device sector in Canada. The vast majority of those people are people that work in the marketing and the regulatory end and the supply to hospitals and or distribution end of large multinationals. There are very few Canadian-founded, Canadian-originated companies that have R&D, manufacturing, headquarters located within Canada. Boston Scientific recently acquired a large portion of a company called Baylis Medical, and they have 850 people working in Mississauga with active manufacturing and ongoing product development and refinement. And so that's been a fairly large presence here in Canada. Stryker's got a large distribution warehouse and sales center operating out of Hamilton. Johnson & Johnson has a presence in the research community through Mars and J Labs and really acts as the agent for the headquarters of Johnson & Johnson to identify opportunities within Canada, primarily within pharma, but also within devices. Medtronic had a large acquisition of CryoCath, which was the company that made that freezing technology for atrial fibrillation that I told you about in Montreal. They had 700 employees there. They're now moving on to different technologies. So there's a change in terms of the level of activity happening in Montreal with respect to what Medtronic was doing. But those people had world-class experience developing a technology that initially was built through an organic entrepreneurial environment, through to an acquisition, through to 10 years of operating or 15 years of operating under the umbrella of a large multinational. So there's a rich pool of talent associated with that entity that is has moved on to other parts of the medtech ecosystem and the financing system, and I think is helping to spur some of the activity in the Quebec area. Siemens many years ago acquired a point-of-care testing company called Epocal and still continues to operate there, and I know some people that work there quite well. And a company out of Quebec City called OpSense made a little pressure sensor for determining whether a blockage in the heart was significant or not. And they were recently bought by a company in Boston called Humanetics. In terms of the larger contract design and manufacturing companies. The two largest would be Starfish Medical out of Victoria and Resonetics. Resonetics is a large privately owned company that does contract design and manufacturing. It's throughout the world. They bought a company in Montreal called Agile MV that had, I'm estimating about 50 or 60 engineers and a number of manufacturing people in a clean room environment. And they're building technologies for large multinational companies in Montreal that are then exported to the world. Other large private medtech companies that you may or may not have heard of, Baylis MedTech is the spin-off of Baylis. So when Baylis was sold, they had 1,000 employees, 850 went to Boston Scientific, 150 stayed on and worked on other technologies other than the main technology for which Baylis was acquired. And I'll talk a bit more about Baylis in a minute. Trudel is a company that makes a number of technologies. Their flagship product for many years was the Aero Chamber, which any of you who have used puffers or have children that have to use inhaled medicines, there's a little buffer chamber that causes the aerosol medicine to disperse before the patient breathes it in order to get a more even distribution of that medicine. But it's privately held. It does extremely well. It was funded by somebody who's passed away many years ago, who used to be a biomedical engineer in London Health Sciences Center. And he then formed this company because he saw a need out of his experiences interacting with the hospital system, and has grown it to a fairly large company. I think they are over 700 people as well when you include all the different components within Trudel Medical. South Medic is a company that makes plastic tubing and oxygen equipment out of Barrie. Those are some of the larger privately held companies that are presumed to be profitable. Because they're private, we actually don't know that much about them. I did a recent survey in looking across Canada. Think of what are some companies that were actually founded in Canada that might be potentially investable into by a large fund over the course of the next 5 to 10 years. I found about 24 of them that are currently revenue generating, and I would say small in international terms, but large in Canadian terms. These are not yet profitable, not that I know of, but these would include companies like IntelliJoint that makes a hip alignment technology. They're based out of Waterloo, and they've been used in a number of well-publicized procedures. If you know Kevin O'Leary of the Shark Tank, he had his hip replaced recently at Humber, and he made a big spiel about this online, about his hip being replaced using an IntelliJoint technology. Flowsonics is making a technology for measuring the fluid status for patients in sepsis in the critical care unit, so that we make sure we don't over-treat them with too much fluid, but we don't under-treat them when we know that getting an adequate amount of fluid into a septic patient is critical for them to maintain kidney perfusion, liver function, etc. Synaptive is making MRI and optical imaging technologies for neurosurgery. Thornhill Medical is making ventilators, and they certainly got a big boost in terms of making ventilators during the pandemic, but they're actually very actively involved in conflict zones around the world right now, providing emergency medical equipment in areas where there's a high level of trauma. Myo1 is similarly involved in compartment syndrome and trauma. It's a company out of Montreal, makes a small sensor to determine if a leg has to be opened up with a fasciotomy to relieve pressure so that the leg does not become ischemic after a motor vehicle accident or after some sort of other trauma. Certainly you can imagine that that might be useful in conflict zones as well. And KA Imaging has developed a very novel X-ray based imaging technology out of Waterloo based on research at the University of Waterloo, and it's doing very well. Some privately held companies, probably the largest of them is Cardium. Cardium was developed in Vancouver. The people who founded Cardium made a lot of money off of inkjet type technology that got sold to Kodak. And so they were independently wealthy, and I think they had an interest in atrial fibrillation, so they put a lot of money into atrial fibrillation. And they developed this big balloon that would send out radio frequency energy in many directions at once to the left atrium. But it was such a big balloon, it almost took up a good chunk of the left atrial space. They've now done a big pivot, and they've converted that from an RF ablation technology to what's called a pulse field ablation technology with a much smaller balloon. And they just raised $100 million to expand their manufacturing facility and advance clinical trials with respect to their latest generation technology for AFib, which is a large growing market because AFib happens in older people, and we know there are a lot more older people. And there's good clinical evidence saying if you treat atrial fibrillation with devices instead of drugs, you can improve their outcomes, including mortality. So that's a big Canadian company. Some of these other ones are much earlier in terms of their stage of development, but none of them have huge revenues because the vast majority of them don't have an approved device to sell yet. And a number of other pre-revenue companies. This one in particular, Northern Vascular, was started by a former faculty member here at Sunnybrook by the name of Victor Yang, who made a company called 70 Surgical, which then got bought by C-Spine. And he's hired a number of people that are now involved in another technology for the neurosurgical intervention space. And then we have our publicly traded companies, Profound Medical. It's valued at about $250 million on the stock exchange. So Profound Medical and OpSense were the two largest, for context. Profound Medical and OpSense were the two largest publicly traded companies in medtech in Canada. They were valued at around $300 million last year, and they were not profitable. And when you compare that to Medtronic and Boston Scientific and Stryker, these are companies that have $50 to $150 billion market caps in the US and are highly profitable. So you can see there's a big discord between what happens south of the border and what's been happening north of the border. It's important to keep that in mind. This company, VitalHub, as a disclosure, I have a small investment in, but they're basically buying companies that help with workflow software inside hospitals, help patients move faster within hospital. And they keep buying little companies that do various aspects, like someone has software that helps move a patient from the emergency room to another part of the hospital, or they know what their census is in the various parts of the hospital. They have, I think, 30 technologies that they've acquired over the course of time that are software-based. And if you know about the public markets, there's a company called Constellation Software, which has done very well, acquiring a large number of software companies over the course of the past 3 decades. And it's been one of the most profitable investments for people in Canada in the public markets over the past few decades. I consider VitalHub as kind of a Constellation software equivalent for hospital workflow. And it's valued, it's probably of all of these, it's the one that's probably valued the most on the stock exchange now. It's around $450 million. So if you're thinking of starting something, you got to think strategically because it's expensive, it's time consuming, and it's a big endeavor to do this. This is not something that you want to do in a sort of lighthearted fashion. There are 2 paths that I can think of that make a lot of sense. One of them is to say, well, let's address a large market, something that is over $1 billion in terms of an addressable market that we can use to attract the tens to hundreds of millions of dollars that we're going to need to make this technology viable, profitable, self-sustaining. Okay. So you can, if you do that and your market size is only $50 million a year or $100 million a year, even if you get 100% of the market, it's going to be hard to convince investors that the potential for return on their investment is going to be there. So that is approach one, is go for something really big and be ready to bring in substantial resources to it. Another approach is to go in such a small market that no one else is going to compete with you in it because it's not attractive to them. And then you have to come up with ways to kind of do that on a very capital efficient basis. But at least you have some assurance that you're not going to have a lot of price competition. You're going to be a sole provider in that area. You can kind of build it up a bit more organically. So you want to kind of think through, am I going to take on a large venture with my team, or can we do something fairly small and niche and almost under the radar with a very focused marketing effort associated with it, and a very focused development effort? Regardless of what you decide to do, you want to think about your competitive advantages. Intellectual property in medtech is really important. So you want to create a moat of defense of patents that can prevent other people from doing what you want to do. So patents in the medtech landscape are incredibly important, are very well defended in courts in the vast majority of jurisdictions in the world, and are highly valuable. You will need those. You also need freedom to operate. In other words, you have to be certain someone else can't tell you you can't do what you plan on doing because they beat you to the patent office with a particular idea. So you want to absolutely have freedom to operate because you're completely stuck if you don't have that. But then you also want to make sure that you have a competitive advantage for the specifics of what's unique to your technology when you bring it to the market. Other competitive advantages are channels or networks. So if you have good networks in terms of key opinion leaders or people that can distribute this technology, maybe you know someone in another part of the world that would be really excited to provide some capital to you if you develop this in Canada, but then you could sell it in Australia or China or Japan and bring in some initial revenue to capitalize your effort with that kind of a strategic relationship. That can certainly be helpful. This is an area where the big companies actually have a real big advantage because their networks and channels are very deep. So you might also want to think about how do you navigate this from a competitive threat perspective as you're building off a new innovation, because you're going to be competing with large companies in this space. Do you have access to unique data or insights that others don't have? Not just technical know-how, but something else about where things are going that are informing you on whether you're going to make a bet with your time and money to take on a new venture? And do you have some sort of perhaps reputational advantage in terms of the people that are involved on your team that can help you move things forward more effectively? And it's not as cold of a start every time you're trying to explain what you're doing. You want to think about the capital requirements. Is there enough access to capital to support what you're doing? There are a large number of small investors in Canada. I'll talk about this a little bit further. There are not many growth medtech investors in Canada. There are very few. You want to think about, hey, we've got a head office in Canada, and this is something the Israelis do very well, is they do their initial development and IP protection in head office within Israel. But then they're very quick to develop a sales and marketing office or finance office in Boston or Minnesota or San Francisco. And then they have a presence there. They start developing some network that allows them to raise funds from that jurisdiction. They're seen as not just a sort of small office type entity that's happening in one corner of the world. It has a bit more of an international bona fide reach. And that's something that I think we should do more often. It gets almost a little bit too convenient in Canada because we're so close to the US. It's so easy to go there. But I think there probably is a strong advantage for companies at the right size to develop a small presence south of the border to help amplify their presence, help amplify their proximity to the world's largest market. You want to think really strongly about capital efficiency. Unlike biotech or medtech, where you can raise hundreds of millions of dollars to develop a new drug, because of the fact that you are developing a new piece of hardware typically, or a new software technology, there's a very iterative component to it. And other people can often make things in the same space. And so there's going to be some competition there. One of the advantages of being a startup is you should be very motivated, very ambitious, very hungry. And the cost of an engineer and a contract design manufacturer in the US, think of them spending $250 an hour, $300 an hour to develop something in US dollars. So if you have the ability in Canada to do something at a lower cost with an internal team instead of an external team, if you have the ability to take advantage of very strong tax credits for research and development, if you have a lower dollar, which is unfortunate in many respects when you want to go traveling south of the border, but good when you need to kind of pay for local expenses. Think about that as opportunities from a capital efficiency perspective, because capital efficiency, especially when the funding environment is as scarce as it is in Canada for these types of technologies, is a really important a part of the approach. And you want to get to revenue generation as soon as possible. One of the first questions that investors will ask you is, well, what are your revenues? And a typical company that's making a new technology that's not been approved, the answer will be zero. But there is a lot to be said for building a company that has some minimal operations, that can generate an invoice, that can manage an inventory, that can go and visit a customer and has a business. So if you can think of an accessory, some sort of ancillary product that either has a very short regulatory pathway that helps you start getting into contact with your customers while you develop the big thing that you really want to drive the company off of, and you have a business that originates from that, that's a strategy that can be very helpful. Once you get to about $5 million of revenue per year, then larger investors become more interested and generalists become more interested. And then when you get to much larger levels of revenue and closer to cash flow positivity, pension funds and private equity get interested. And there are groups within the private equity community in Canada and North America that would very happily invest in a cash flow positive company that has revenues of $100 million or more. But you can imagine the gap between that small sort of shop-based type organization that's pre-revenue to then getting to being of a large scale that's attracting private equity or pension fund money is a very big bet. You got to think, are you building a technology? Are you building a company? Are you building both? If the goal is to build a technology, then you want to start thinking early about opportunities to license it out. That might be better than investing in building up a sales team and a legal team and a large accounting team. You're going to need a legal and accounting team anyhow. But it might be of a much smaller scale, and your manufacturing team and your regulatory team might be much smaller. So if you're just doing something that is really neat and inventive, but you don't want to build a company, think of licensing or think of selling it off early to a larger company. If you're going to build a company, then you got to think about not just the R&D, but all of these other dimensions that consume a large portion of time and a large portion of capital, but are quintessential to being able to actually make a viable product. And if you're seeking investment, anticipate that the founders are going to spend a large portion of the time seeking capital. So sometimes the founder will have a good sense of the technology and the motivation behind it and be a really good salesperson for it, and probably have a lot of ideas that could contribute to all these other dimensions of the business that I list up at the top. But you should anticipate the founder spending 40 to 50% of their time raising money, because one of the first things you do after you close a round of funding is think about how you're going to raise the next round of money, because it's only going to last so long. Okay. So that's something that people often underestimate, myself included. I want to talk about Baylis Medical briefly. It's a very interesting case example of success, and I think there are a lot of learning points from it. So I'm just going to talk briefly as an outsider as to what the history of that company was like. I apologize to the founders if I get any of this wrong, but I think that I'm relatively accurate on the vast majority of these points. They started off over 25 years ago as a medical distributor, selling other people's products. And Frank and Chris were engineers at Waterloo. Their mother, Frank's mother, was the woman who started this company. But Frank and Chris soon got very involved with it in terms of selling devices from other parts of the world to the Canadian healthcare system. So they had a sales channel, they had an accounting group, they had to manage the quality of these technologies and report to Health Canada and make sure that the regulatory aspects of it were being managed. And they had a good finger on the pulse of what the healthcare procurement community in Canada was like. And they used their engineering skills to build a very niche product. They worked with a key physician at Sick Kids to treat a condition called pulmonary atresia, which is when the pulmonary valve, which feeds all the blood from the heart to the lungs so that the blood can get oxygenated, you need to make a small hole in it if that valve is blocked when you're born. So they made this technology that could go up and burn a small hole in the pulmonary valve to get a wire across, to then allow them to dilate that valve and turn blue babies into babies that could then oxygenate properly. Very, very niche application. It was called the Toronto catheter. So they built that technology while they were doing their distribution. And they also used that ablation technology to develop something for the spine pain space, where they did some ablation of the nerves in order to treat chronic pain. And they sold that technology to Kimberly-Clark, and they got a large sum of money, a reasonable sum of money from Kimberly-Clark that they could then bring back into their home company, and they used that to fund the next set of development. And that's where they started expanding on the use of this Toronto catheter to get access to a structure of the heart called the left atrium. And the left atrium was being used, well, it's being used by the heart with every heartbeat, is being used as a way for doctors to go in and do these ablation procedures to treat atrial fibrillation. So you had to make a small hole in the septum between the right atrium and the left atrium to get to the left atrium to do these ablation procedures. And these ablation procedures, they were very small volumes at the time. They were in the thousands per year initially, maybe tens of thousands per year. They had big complication rates associated with them. If you perforate the heart and you end up with a bunch of blood filling the area around the heart, then the patient's literally in cardiac arrest. You could cause a stroke. You could cause problems with communication between the esophagus and the bloodstream of the heart, which is a horrific event to occur. And there were bleeding complications. So there were a lot of complications associated with atrial fibrillation, and it only worked in 40 or 50% of cases at the time. What happened over the ensuing years is that more and more people started getting atrial fibrillation. The technologies to burn and modify the heart within the left atrium became more effective. Imaging devices came in to help make the puncture safer. And Baylis was really the first one at the door with respect to, well, where's the needle that you use to get across? You could use a very old sort of needle to puncture across, a mechanical needle, but they made an electric needle that allowed them to just press a button and it pops across. And that had more control, more safety associated with it. And so physicians really liked that. And AFib ablations now are happening in the hundreds of thousands per year. And at the same time, other procedures in the left atrium started happening, like left atrial appendage occlusion and mitral valve closure and left ventricular lead placement. So it just so happened that Baylis was fortunate. They had a technology that was very differentiated, that was initially built for a very small niche, not that difficult of a technology to manufacture, to be honest. And they were able to use that in a number of growing applications. They ended up growing to being 1,000 people. And they ended up having manufacturing facilities, and they focused on the automation within their manufacturing facility. They had a really strong partner in Japan that had 100% market share for ablation procedures in Japan with very favorable reimbursement in Japan. So a lot of things happened that were very favorable for them. And over the course of time, they became this overnight 25-year success story. And they then developed a technology because they were contracted to work on ablating liver lesions. So they took that opportunity and sold that technology off, and that further capitalized them. And then when COVID happened and the government of Canada looked around and said, hey, we need more ventilators, they went to Thornhill Medical and they went to Baylis. And they said, please build us a lot of ventilators very quickly. And they were involved, and they used their extensive know-how in manufacturing and electronics and quality processes to be a large supplier of that at a time when there were very favorable margins on these pieces of technology. And they sold. They ended up getting an offer, went to multiple companies for an exit, and they had a large number of people bidding on their technology, and they sold for 2 billion Canadian dollars to Boston Scientific. And as I said, they kept 15% of their business. Only 2 people owned the business, and they did all that development and all that impact. When I was traveling around the world to different places like Japan and China and the US and Europe, and going to their cath labs with some of the technologies that one of the companies I've co-founded developed, you'd see the Baylis boxes in the corner, and they're doing structural procedures just down the hall. It was a very high international impact Canadian company. So I think some things to learn from that story are that you start off, they started off with a path to profitability as a distributor. They were sustainable. That was their home base for the company. They didn't try and swing a home run overnight. I think of it more like doing a bunch of bunts and singles and doubles to get people to run the bases to then have success and have a winning team. They did get some luck. Luck favors the prepared, but they certainly were lucky in a number of areas. And I think that they would be the first to admit it. I thought they had, one of the things culturally they had really good contact between their most senior management, including the 2 founders, and the clinical community. They knew what it was like in a cath lab, how these procedures were being done, what the details of what worked, what didn't work. You didn't end up with this large separation or knowledge mode about what truly was happening versus what was thought to be driving the business and where the opportunities were. So I think maintaining that dynamic range of being able to be a high-level thinker, but also being able to get into the nitty-gritty of what your customers are going through and where the technological opportunities are is really important. I think Baylis executed on that quite well. They did really well at leveraging non-dilutive capital. They got a lot from the government at various points, and they also got a lot from these strategic relationships and contracts. And they had a very international mindset. Worked a lot in Japan, worked a lot in Europe, worked a lot in the US, had an office in the US that I think employed it was between 30 and 60 people. They had a direct sales force in the US based out of Boston. And they did very well, and they were very capital efficient. They always knew they were spending their money. They weren't spending someone else's money. And they were also very time efficient. In particular, they didn't have to go and raise money and spend half their time raising money from others. They already had that cash flow coming in to help them focus on the true needs and the growth opportunities of the company. And a lot of people who've worked at Baylis had really positive sentiments. And when Boston bought them out, a large number of them stayed there and moved forward. This is a picture of me with 2 co-founders when I was much younger, with less gray hair, fewer wrinkles. But this is me in California, just outside of a restaurant in Palo Alto, with the 2 co-founders of my first startup company, Kerberos. And I bring this up because if you're getting in the medtech space, you want to make sure you have a team that has a mindset that can work well together and that has the variation of skills and aptitudes needed to be successful. So I was the clinical and engineering person. Tom was also an engineering person. Tom's the redhead at the bottom on the right. He was very thoughtful and very organized, very pragmatic. And in the middle, John, very, very good storyteller, very good visionary. He was the one that could sell from a financing perspective. He's the one that could sell in terms of initial sales. He's the one that helped put a large portion of the team together. So we had very complementary skills, and we enjoyed working with each other, and we were very approachable to each other and available to move things forward. This is not 9-to-5 type stuff. You do have to be open and able to stretch yourself in order to make a venture of this nature succeed. And I think it's also important, you want to have clearly defined roles so that you know who each of you are, and so you have some organization to your team, but with a highly cooperative spirit, such that when there's someone who needs backup, when someone needs something to help you out or an additional set of eyes on something, you need to have that. And I mentioned dynamic range here. This is something I learned from people in the Bay Area. People who are very interested in the high level, but also ready to dive into the details when there's a specific opportunity or challenge that requires that deep dive. And it's not just like, well, we're going to leave that to consultants, or we're going to leave that to someone who we think is experienced. You have to be able to go in and do some of these things on your own. You have to leverage other people, without a doubt. No one can do everything on their own, but you also have to almost lead the team sometimes down some of these rabbit holes in order to be able to come out of them successfully. This is a picture of the team at Canavi the day we got our most important 510K clearance for our flagship product. You can see that the background, this is an office space we just leased that had absolutely no office space in it yet. It was just a barren warehouse space. But every single one of the people in this picture were heavily involved in this major milestone for getting approval of the world's first device to combine ultrasound imaging with an optical coherence tomography technology that applies to one of the largest conditions in the world in terms of morbidity and mortality. So things to remember when you build these teams, these are people that you end up working with in the future. It's amazing how often people refer to their alumni of medtech ventures in the past. And it's one of the things that's most motivating for me as an entrepreneur is working with people that are very like-minded and motivated. As an entrepreneur, you want to know your market and you want to know your customers well. Their key opinion leaders have really important roles because the key opinion leaders who are traveling around the world and seeing the other technologies that are out there, they can provide you a lot of important insights. They have probably the highest level view and things that are not even public yet that they can give you insight on to watch out for. And they'll be strong speakers at a podium when your technology is ready to be spoken about and amplified in a public forum. But you don't want to just rely on key opinion leaders because often they might have conflicts of interest, or they might be so busy traveling everywhere, or they might have 15 other companies they work with that you don't get all the attention that you need. So I would think also about maybe getting some up and coming leaders, people with potential, whether it's a very advanced fellow, whether it's a new staff member who's shown a lot of interest in the innovation space, but some sort of clinical representative who's very accessible, very keen, willing to invest some fairly detailed time with you to help you refine your technology, help you to get opinions, help to educate you on some of the nuances that maybe a key opinion leader would say that's above my pay grade. I'm not going into that world with you because I just don't have the time, and legitimately they might not have the time. And then you want to be not just in the academic centers and in the centers where people are providing the most tertiary and coordinary care, because the vast majority of the market is actually community hospitals. And you want to say, hey, how will my technology work at community hospital X, where maybe they aren't on faculty and they aren't doing research, but they're seeing patients 6 days a week nonstop, and they're very efficient with their work. And they're actually the ones that are getting the vast majority of the healthcare delivery done. You want to have a few of those people that you can bounce off to really acid test, hey, are we heading in the right direction in terms of a mass adoption technology? When you're thinking about payers or who's going to buy your product, this is important. If you're in Ontario and you want to sell a product used for a procedure, like a surgery or a cath lab procedure, there's only one way to get that technology funded. That's to sell it to a government-funded hospital, to physicians who are paid by the government to do that procedure, and that's your only market. There's no private insurance option, and there's no patient-payer private option. When you go to the States, that changes a bit. There's a little bit more competition. Patients can say, hey, I'm willing to pay for this new technology, and they can have some direction with their healthcare providers. It's a much more competitive system. And you can also get private insurance companies to pay for some of these technologies, perhaps earlier than Medicare or Medicaid might be willing to pay for them. You have to think about the dynamics. These hospitals compete with each other. So they want to have the latest innovation available at them. And the insurers want to be seen as providing good care to the members that they insure. And so if you have something that's useful, even though it's not gone through the cost effectiveness analysis and the scruples of a very cash constrained publicly funded healthcare system, having alternative ways of selling your alternative payers to sell your technology to is indeed very helpful. A much shorter time frame worth considering. If you're selling something that is immediately cost saving to the hospital, the world's your oyster. They will buy it upfront. They're all cash constrained. If it's a cheaper version that is as effective or an alternative version that saves them time, think also about the economics, not just of the purchasing price, but of the time saved. A hospital, it's about $1,500 to $3,000 per day for a patient to be in the hospital. $3,000 if they're in a critical care unit. You can double or triple these numbers if you're south of the border, but in Canada, it's about $3,000 a day in a critical care unit, without even accounting for procedures or CT scans or MRIs. That's just to reside in a critical care bed. Okay. A cath lab costs somewhere between $1,500 to $2,000 to operate before you even start talking about the devices that are used there. We're paying the staff MD. That's for paying for the nurses, the cleaning, the capital depreciation, keeping the lights on. It's very expensive. So if you come up with technology that helps take down the short-term acute episodic care costs, because hospitals are typically paid for a diagnosis and a treatment plan. So they come in with heart failure, they get this much per heart failure patient, and they get this much for myocardial infarction, where they stay for 1 day, 2 days, 3 days, 4 days. Some variability to that, but for the most part, if you can shorten that by half a day, $750 to $1,500 of savings right then and there. If you have a technology that helps reduce that cost of care, that is something that's going to be very immediately attractive. If you have a technology that says, oh, we're going to stop them from coming in the emergency room 3 months down the road, or they'll live longer, that's a very different argument, because the hospitals don't get revenue based on that. They get it based on the acute episode of care. That's when you have to then pitch to the larger payers like the insurers or the government to say, hey, we're going to save you money because they're not going to come back to your emergency room, or they're not going to be rehospitalized 3 months down later. And that's a much slower sales process, because now you're getting political. And that's a 2, 3, 4 year sales process that's very dependent on a small number of individuals to agree with you. And there might be all sorts of barriers to making that happen. Also, selling into high volume procedures is much more difficult than selling into niche procedures. If you're saying to the government of Ontario, hey, we've got a technology that's going to be used for your heart failure patients, and heart failure is one of the leading reasons for admission, unless it's immediately cost saving, they're going to sit there and think through, all right, if we did this once or twice, not a big deal. But if we do this for the tens of thousands of patients that are admitted with heart failure every year, that's a large portion of the healthcare budget. And they're going to be much more cost sensitive to making any changes to that recipe, because there are so many patients affected by it. If someone comes in with a unique congenital disorder or unique malignancy, and there's a lot of interest in making it happen, there tends to be less focus on the cost of that per patient, the per patient cost, because the impact on the global budget's far less. So you'll often hear of drugs like orphan drugs, orphan applications of devices, and regulators will typically be more lenient in terms of allowing these things through, because they know there are fewer patients at risk to exposure to that technology. And payers are going to be less sensitive to it because it'll apply to a relatively small number of patients. There might be campaigns to help Johnny survive their hospital stay through a GoFundMe or through some sort of news press or through some philanthropic support. And so you can imagine that there are pathways where there's less sensitivity to the per patient cost to enable things to happen, as opposed to the more common procedures. So that's just one thing to be aware of. And then competition. So knowing your market and communicating with customers, you have to know your competition better than anyone else. So be very, very, very resourceful in terms of how you learn about the market opportunities, what other companies might be thinking about, what their IP landscape is, because that is going to be very key as you move forward. And you'll learn a lot about what you should be doing through that process, not just what your customers, what your competitors are doing. I spoke to you briefly about healthcare human resources, and I'm going to provide just a brief case example here of someone who is very attuned to this and how it's really addressed an issue in the nursing homes. So we mentioned the aging populations, more people in nursing homes, a lot of costs associated with care to the elderly, and a huge amount of short staffing happening in nursing homes because of the growth that's happening there. Point Click Care is a software company out of Mississauga. It now employs 2,000 people, right next to where Bayless was, just coincidence. But 2,000 people, and it's because the two brothers that co-founded the company, Michael and David Wessinger, their mother came home one day as a RN at a retirement or nursing home and said, there has to be a better way to dispense these pills. There has to be a better way to schedule when we see each resident to make sure they're getting the care they need. There needs to be a better way to document what their medical conditions are so that if they end up having to go to the hospital, we can provide a package to the ambulance and it's all nicely summarized. There has to be a better way to make sure that we recognize when they might need a visit from the doctor within the nursing home on a sooner basis rather than a later basis, or bring a family meeting in. So they developed this electronic patient care support system, and it's now used in thousands of nursing homes across North America. And it's probably impacted hundreds of thousands of lives today. I know our Veterans Affairs just across the hall, the largest veteran retirement home in Canada, uses it for its population. And I know that some of the large nursing home networks here in Canada do it. And think about this, you're selling a piece of software that's going to save money to nursing homes. And it's not like there's one owner of all the nursing homes in Ontario. There are 50, 60, 70, 80 of them. So you now have a willing customer, and you're not dependent on one customer to start buying your technology and giving you feedback. And this is not just a Canadian issue, this is a US issue. So they have a large US presence for point-click care. And it's high margin, it's high data. They're collecting a lot of data to help improve care of the elderly and the people in need. And so this is, I think, a really interesting company that's done very, very well. And from a healthcare human resources, they made it easier for people to work in these retirement homes and to feel like they're doing a good job and retaining them and being more productive. And so I think it's been helpful from a healthcare human resources perspective and care of the elderly perspective. There are a few companies that recently sold in Canada at a relatively early stage. You normally hear about early exits in the pharma biotech space. Oh, we finished our phase 1 trial and then Novo Nordisk came by and bought us for a few $100 million. Or we finished our phase 2 and got bought out for $1 billion. Okay, that happens in the drug space because our drugs, you got to think, is 5 or 6 times larger than medical devices. There are more hungry there's a more hungry or competitive landscape on the acquisition side. And really, when you're thinking about a drug, whether it's a pill or an injectable, the application of that once it's approved and shown to be effective is relatively straightforward. There's not as much of an education program surrounding it as there might be in a new surgical device, for example. So it can be scaled from a marketing perspective very quickly. And certainly these large companies know how to manufacture these drugs very effectively. Devices, the manufacturing processes are very specialized for the particular device that you're building. So early exits in devices are a bit less often than they are in the pharma biotech space. But we have a few examples in Canada. 7D Surgical was co-founded by an interventional neuroradiologist and spine surgeon, and a few local engineers here in Toronto that were working in his research lab. They did a few hundred cases and then sold to a company in the orthopedic space in California called C-Spine, and they used that capital to then go on to their next set of ventures. Molly Surgical is a company started here at Sunnybrook and used clinically in our breast program, and was recently sold to Stryker. The amount has not been publicly disclosed. Stryker is very large, and this was relatively small, so they did not have to disclose it from a public disclosure perspective. But I'm told that it was a very good return for investors. And there were 2 companies involved in the drug discovery space, so a little bit off base from medtech, but certainly in the digital health side, called Cyclica and Valence Labs, one based here in Toronto, one based in Montreal. And they sold simultaneously for just north of $40 million last year. And so all these companies are going to recycle some of that capital back into the ecosystem and work on their next set of ventures. And certainly one in the hand might be better than 2 in the bush. As I said, medtech is dominated by Goliaths. You've got the companies that I've listed here that we've spoken about a few times. There are some others that are stepping into the space, whether it's smaller mid-cap companies like Haemonetics or Fresenius or ResMed or Insulet. And then some of the drug companies also have plays in the medical device space. Bayer has a division that's related to injectors for radiography. So you can get groups who want to expand into your particular niche and be a little bit under the radar, unexpected parties of interest that might want to invest into or acquire the technologies that you build. There are also the big digital health companies. They all have healthcare play. They haven't figured it out yet, but they all have a healthcare play in terms of what they want to do. The Amazons, the Googles, the Microsoft certainly has a large play in the medtech space. And so they're moving into healthcare, and certainly they draw a lot of attention, especially to the digital health type companies. When these companies get hungry, they seem to do so in waves. Stryker has bought 6 companies in the past 6 months, including Molly Surgical. Johnson & Johnson, I was in the cardiovascular device space, and I still am, but cardiovascular devices, especially if you're in coronaries, instead of structural heart or electrophysiology, coronaries was an area that was not very fashionable to invest in for the past 5 to 10 years. But Johnson & Johnson has put out a large mandate to expand its cardiac business and has made several large acquisitions over the course of the past 2 to 3 years. When you think about the Canadian landscape for funding, you want to think about the landscape. And I told you there are a fair number of angel investors and friends and family. You can raise $1 million. You might even get $1 million check from a high net worth individual for starting up your company, but maybe not likely to be much more than that. Government agencies and life science VCs over the life of your company, they might put in a few hundred to $10 million into a medtech venture. And then at the other end of the spectrum, you've got groups like OMERS and Teachers Pension Plan and Canadian Pension Plan, but their smallest check size is $50 million. They like to write $100 and $200 million checks because they have $200 to $600 billion of assets under management, and they just don't have the time to make an investment into a promising startup with a $5 million check. It doesn't move the needle for their portfolio enough. So there's a big gap in Canada with respect to funding for companies that have hit that stage where they've got early clinical revenue, a developed product, maybe their first regulatory approval, but they're not going to get big enough to be attractive to the late stage investors or to go public easily or to be acquired without someone filling in that gap of the funding zone between $5 to $30 million. And so this is something that I've been thinking about quite a bit over the course of the past year. It was spurred a little bit by some of my comments that I made at last year's event. And so I think this is an area that is important for us to address in Canada to improve our success rates. So that concludes my comments. I hope it was interesting and helpful, and I'd welcome any questions from the audience. Thank you.